Joanine Nanynge, and I'm a lawyer currently working as a project officer with an NGO called Human Rights Awareness and Promotion Forum. And we're also part of a coalition to stop maternal mortality due to unsafe abortions. Today we are basically talking about one of the issues that we're discussing today, since it is the International Day for Global Access to Safe Abortions, to safe and legal abortions, is that we want a law in Uganda, a codified law that talks about how to access safe abortions in Uganda. Of course, there are concerns that having such a law in this country is going to increase the number of abortions done by women and young girls, but I think it is not true, because currently, even without such a law, abortions are happening. And if you look at the statistics and the research that has been done, it is very clear that most of the girls that are dying due to maternal mortality are dying because of unsafe abortions. So we think that the risk of increasing abortions is much lower if you look at the benefit of reducing the number of girls and women that are dying due to unsafe abortions. We do think that most of the people that die due to abortions die because they're having unsafe abortions. In Uganda, it is still very illegal. It is, although the law is not prohibitive, but it's rather restrictive, most people have interpreted it to think that abortion is totally prohibited in Uganda. So they engage in very unsafe methods to do abortions, like using hangers and taking jig and overdosing on very many other medicines, which is causing them to die. And even when they find themselves in such tough situations, the doctors are not allowed to provide post-abortion care. So this law is going to be very codified to talk about how women can access legal abortion and safe abortions, and to also allow doctors to be able to provide post-abortion care. The law is not going to be encouraging women, every woman who wants to have an abortion, to go and have an abortion. It is only going to be looking at those circumstances where really it is just fair. Speaking from a healthy point of view, it is just fair that a woman accesses a safe abortion. There are very many instances someone could have been raped, maybe there is incest, maybe it is just detrimental to the health of the woman to actually carry the pregnancy. We want that in such circumstances a woman is allowed to actually access a safe abortion, instead of them going and having an unsafe abortion that is increasing maternal mortality in Uganda. So this law is really not to increase abortions in Uganda, but rather to reduce the deaths of young girls and women that are dying due to unsafe abortions, which are very rampant.